This is Dierdre Fitzsimons, and this presentation will give a brief overview of the PD-STAT application. PD-STAT is a drug reference for nurses, medics, physicians, and respiratory therapists caring for pediatric patients. Designed by a pediatric ER physician, the application offers weight-specific drug dosages and recommended interventions and equipment sizes based on age and weight. Almost all pediatric medication dosages are weight-based, so they are very patient-specific. The application offers rapid results in one place, therefore decreasing time spent on the spot and human errors in calculating. The application is available for purchase on Apple iTunes as well as Google Play for $4.99, and it's available for most smart devices, allowing for quick and easy reference. This application is beneficial for anyone administering pediatric medications. This includes nurses. It can be used as a reference to verify and double-check orders to ensure they are correct. The app also includes airway interventions, including endotracheal tube sizes and intubation medication dosage, cardiac resuscitation, including medication dosage, cardioversion, and defibrillation, seizure medication dosages and administration times, allergic reaction medication, antidotes, and normal vital signs ranging for age. The application also offers the Broslow color scale reference. This is a color-coded tape measurer used in pediatric emergency situations to quickly estimate the patient's weight based on their height in order to calculate drug dosages. This app offers nurses a reliable, accurate, portable reference on the go in any setting, including emergency rooms and ICUs. With just a few taps, the nurse enters any combination of age, height, and weight. The more information included, obviously the more accurate the results, and instantly has access to weight-based dosage and recommended administration times. From the main screen, you select each of the options, or as many as you know. Let's say you have a 2-year-old. You can either enter the age or the birthday and have the age calculated. Let's say your 2-year-old weighs 30.9 pounds. Weight can be entered in pounds or kilograms. And immediately the next screen offers a list of categories broken down by disease process, treatment, or interventions. Let's say you're wondering about a PRN seizure medication dosage. You click seizure, and there are all the seizure medication dosage ranges for this patient's weight and age. Any important considerations, including push times and dilution requirements, are provided right below the medication. You can double-check what the doctor ordered against your PD-STAT app results and feel confident the correct medication is ordered. It's just that easy. The safe ranges are listed below the medication with the weight-based range to the right. The interface is intuitive and user-friendly. It is visually appealing and flows effortlessly between the screens. There's a back button at the top of every screen to take users to the previous page. The simplicity of the application makes it successful in its intended use, a pediatric weight and age-specific resource. At the bottom of the screen is the patient's age, weight, and height, so you know you're still on the same patient. The application does not violate any patient privacy since the only information entered are patient measurements. The patient does not interact with the application. Its only intended use is for healthcare professionals. The application does collect the user's name, email, profession, and area of practice when registering. This information is protected using Secure Sockets Layer software, which is an encryption of personal information and is hosted on a secure server. While the calculations are correct, the application does note that medication dosages and equipment sizes vary. The developer explicitly denies any liability associated with use of the software. All medication dosage and equipment size calculations are determined and updated based on evidence-based research, and the application offers a list of references for the information provided. The application is updated often, most recently in December 2017, and it lists the last updated time. Overall, I do recommend this application for anyone working in pediatrics. The application is very easy to use and simple. The information provided is up to date and the calculations are accurate. Nurses can easily open the app from their smartphones wherever they are, enter a few measurements, and have access to a large amount of data. Medical errors can be reduced by eliminating the risk of miscalculations and offering a reference for nurses to double-check orders. The cons are the price, $4.99 is not horribly expensive, but there are free applications available out there, which could make this app less desirable to some. And of note, the Broslow color scale is not used by most pediatric nurses except in emergency situations, so this might not be very useful. In conclusion, the PediStat app is a great tool for nurses who are responsible for providing weight-based medication to pediatric patients. The application has a great amount of valuable information available at the nurse's fingertips. I bought it and I would highly recommend it.